of Guam, Lou Leon Guerrero, the Lieutenant Governor of Guam, Joshua F. Tenorio.
Half a day. Today I want to leave you with no doubt about how serious the situation is and how vital it is that everyone, individuals and businesses, follows the advice that has been issued. As of last night, we have a total of 45 confirmed cases of COVID-19 on Guam. 8 of those were confirmed yesterday. Over the last few days, we have been seeing an increase in positive cases. And I cannot stress this enough. If we all do the right things now, we can reduce the impact and save lives. If we don't, more people will become sick and our elderly, fragile healthcare system will be even more overwhelmed. Later today, I will sign Executive Order 2020-07, which will extend the closure of non-essential businesses and facilities to April 13. Life shouldn't feel normal right now. Every time you think about meeting up with someone, ask yourself if it is really necessary. And if it is not, please do not do it. When you're doing your shopping, try to consolidate it into one trip to minimize your exposure outside and stay 6 feet away from each other. Social isolation does not mean you can go to your friend's house. And when you do go outside, go on your own. And if you're elderly or belong to a vulnerable group, please stay home. But I also know that for some of you, staying home and not being able to work is difficult. As part of this effort, Executive Order 2020-07 will also include a moratorium on eviction proceedings for the duration of this public health emergency. This means that you and your families will not have to choose between keeping our island safe and paying your mortgage or worrying about your rent. While I may not be able to answer all employment questions at this moment, I do have an update for those who are currently being employed by the Census Bureau. The government of Guam, with the concurrence of the U.S. Census Bureau, is pleased to announce that the 2020 Census of Guam employees during this period until April 13, in which operations are suspended, will be compensated under its current contract with the U.S. Census. Guam Census employees can expect to receive compensation as early as this upcoming pay period. As with rent and employment, you should not have to worry about the cost of items at the grocery store or gas station. Executive Order 2020-07 will clarify the current price gouging law. The prohibition on price gouging during this public health emergency is a price cap, not a freeze. This means that while prices of goods, services, or dwelling rentals cannot increase, there is nothing in the law that prevents prices from decreasing. We will do all we can to help you. I also know that many of you are concerned about the USS Roosevelt. Yes, 23 of its crew have tested positive for COVID-19 and are being treated in isolation at Naval Hospital. The ship will return to Guam using the dock furthest away from our port, and its crew will be quarantined at the pier. They assured me that the military will follow CDC guidelines with isolation and quarantine. I am told that none of these sailors will be permitted to frequent the naval base, and there will be a strict no contact policy between civilians and service members on Guam and the incoming ship. As the governor of Guam, I have the authority to turn away a civilian cruise vessel. That authority does not extend to vessels necessary to national security. The Admiral understands how seriously I am taking this, and he understands that my ultimate duty is to keep Guam as safe as possible. As you may already know, I received a call regarding the passage of H.R. 1365. This is a great milestone for Arman Umku, and we can finally close this chapter in our history. I was told that because Ms. Irene Scambaluri has been a tireless advocate. She was the first person the White House contacted after signing the bill into law, and she will be receiving the signing pen the president used. Yes, yet as difficult as these times have been for so many, there are always points of light in the darkness. In times of uncertainty and doubt, some engage in acts of goodness and courage that call on us to do the same. Today's COVID hero is Emma Flores. Emma is 15 years old and a ninth grader at Tijan High School. She is in her 7th year of Guam Girl Scouts. And every year, Girl Scouts are encouraged to do a take action project where they find a problem and think of a sustainable solution. She realized that some stores implemented a mask policy and you couldn't go in without a mask. But a shortage of masks meant not everyone could go to the store. After getting help from her grandmother and troop leader, Emma started making masks. In 2 days, she made 20 masks and donated them to the store to pass out to patrons. Thank you, Emma, for being a COVID hero. I will now ask Linda DeNorsi to give you an update on the cases and their demographics.
Thank you, Governor. As of yesterday, there were 40 tests that were conducted, and of the 40 tests, 30 were negative, 8 were positive, and 2 was inconclusive. The testing from March 12, 2020 to March 26, 2020, there was a total of 308 tests. And of this 308, 263 are negative and 45 are positive. And of the breakdown of those that are positive, 31 remain in home isolation, 4 are at SNU, 9 are at GMHA, 1, of course, died, and that amounts to 45. For the demographic information, 12 reside in the northern, 19 at central region of the island, 8 at the southern, and 6 are pending further determination. In regards to the age group of the 45 COVID positive patients, there are none within the age group from 0 to 19 years of age. There are, however, 3 in the age bracket of 20 to 29 years of age, 4 from the 30 to 39 years of age, 8 in the 40 to 49 years of age, 8 also in the 50 to 59 years of age, 14 for the 60 to 69 years of age, and 5 in the 70 to 79 years of age. And from 80 years to 89 years old, we have 2 COVID positive cases. And for the age bracket of 90 years and above, 1, and that all amounts to 45. For the gender, we have 16 that are male, 29 are female. In regards to the medical status of all these patients, 31 are stable, 13 are hospitalized, and of the 13 that are hospitalized, 7 are in the inpatient area of the hospital, 2 are in the ICU units, 4 are at the SNU units, and 1, of course, died. In regards to the travel history, we have 1 from Japan, 7 from the Philippines, none from South Korea, 2 from the US mainland, and no travel history at all. We have 35 of those positive COVID cases.
Any questions? We're open for questions now.
Okay, thank you, Governor, and thank you, Linda. Just a reminder, we're only going to unmute you for the Q&A portion, and you get 1 question and 1 follow-up. We'll begin with PNC. Kevin, your question?
Yes, good afternoon, Governor. This is Kevin at PNC. Can you hear me?
Yes, good afternoon, Kevin.
My question is, can you give us your best view of the status of the coronavirus relief bill that is now in the House? When do you understand the House will act? How soon after passage can island residents and businesses expect some relief?
Right. Okay, so I understand the House is, it's in the House, and my information early this morning is that they're expecting the House to pass it today, and the President is anxiously waiting to sign it. My understanding also, Kevin, my biggest tracking of this is the direct subsidy to the governors. And that's about $150 billion that they have identified, and that they would be giving $3 billion of that to the states, to the territories. And off that $3 billion, Guam will be getting about $111 million. It's going to come out of the U.S. Treasury. They really haven't yet gotten the details, but I know that President Trump wants to immediately give those to the governors of the states and territories, and he also wants to quickly give those assistance that are immediately going to help employees and employers right away. All of this, I understand, is going to go through FEMA, and FEMA will be the leading agency that's going to then work the process on how these grants and these assistance are going to go through. They're still not, they don't have the processes in place all set and in details, but I'm hoping that we would start getting it in 2 weeks if they sign. We are very much, Kevin, in close contact with the federal counterparts of our agencies. I know that with our Medicaid, SNAP programs, child nutrition programs, that the administrator is in very close contact with her counterpart. That education is going to get some big money also, and I know the superintendent is on top of it with their administrators. We are trying to get a hold of the U.S. Treasury to find out what process they are looking at. So I'm sorry that doesn't give you any definite timeline, but I myself don't. I'm hoping that, like I said, within 2 weeks that we would be able to get at least the direct subsidies and the immediate grants that do provide direct cash help to employees and employers.
Thank
Kevin,
you.
your second question?
A different subject. The Attorney General's office this afternoon issued a release saying that they're investigating nearly 60 price gouging complaints since this first COVID-19 case was diagnosed a couple of weeks ago. Is there a word of warning or anything you want to say to those few perhaps out there who may be trying to take advantage of this situation?
Well, the word of warning is that through this executive order, I am really going to enforce it. And we are working with the Attorney General because he is also, like you said, investigating. So we are going to be enforcing, and there will be penalties to those individuals that do price gouging.
Thank you, Governor.
Thank you, Kevin. Next is Pacific Island Times. Joanne, your question?
Hi, can you hear me?
Yes, I can.
Okay, hello. Well, my question is related to the Roosevelt. I was wondering, how will all those 5,000 sailors be tested if Guam doesn't have the proper supplies to test the people here already, or like enough to test everyone here on Guam? As I remember in a press release, it said that everyone here is at risk if you attended mass or if you attended any gathering within the last month or so. So what's the issue with the supplies for those 5,000 sailors?
Okay, thank you. Let me just make something very clear. The whole system of the military isn't going to impact the community. So they are going to provide the test themselves. They are going to provide the isolation facilities themselves. They are going to provide the quarantine facilities themselves. Nothing that they are going to be doing in terms of infection control actions, in terms of surveillance, in terms of quarantine, is going to impact our community, our civilian side. They have their own system and their own supply inventory, so nothing of that. So they would have their own testing supplies.
Joanne, your second question?
I believe that's about it. I mean, I have a question about the 150 sailors at the Guam Reef. So those sailors at the Guam Reef, they have no impact, or like they're not related to the Roosevelt?
No, they are not related at all from the Roosevelt. And, we're still trying to run that down. And as soon as we get any information, of course, we will inform you. I did talk to Admiral Manoni this morning, and I asked him about this situation, and he said he has his chief of staff investigating it. So he will get back to me.
I think they're airmen, not sailors.
They're airmen, not sailors. So they came out of Anderson Air Force Base. But we are running it down.
Thank you,
Okay,
Joanne.
thank you. Thank you.
Okay, next we have Mariana's Business Journal. Brianne, your question?
Yes. Hello, Governor. With this extension of your executive order, if the cases do seem to increase and the curve isn't flattened, are you considering extending the executive order again?
Yes, absolutely. And the reason for that, I just want to make it very clear that my first and foremost priority as governor during this crisis is the safety and the health and saving lives out there. So we are tracking this every day. And if I continue, if the increase in trend of these cases continue, we will continue to, again, strongly enforce what the directives are out there. And that's why, Joanne, Rayanne, I am always pleading with the community, please take this very seriously. I do not want any more fatalities. I don't want to overwhelm our healthcare facility. I don't want to burn out our first responders and our healthcare workers, as they are the ones that will be taking care of our sick patients. So I am again pleading with the community to do their part, as I see you as the soldiers of the war against this virus.
And Rianne, your second question?
Just my second question is, what kind of factors or criteria do you consider when you're deciding to extend your executive order?
Well, of course, the number of cases that are increasing. I'm also basically the number of cases that I am seeing and the capacity that we are having in terms of it being overwhelmed by this virus.
Thank you, Rianne. Next is KOAM. Nestor, your question? Nestor, go ahead. Sorry, 1 second, Nestor, stand by. Okay, Nestor, are you there? Okay, can you turn your mic up, please? Nestor? Okay, Nestor, we're gonna move on to the next one. We'll circle back to you, okay? And we'll go to Guam Daily Post. Nick, your question.
Hi, Governor. Good afternoon. How are you doing?
I'm very good. Nick, thanks for asking.
All right. Well, thank you so much again for your time today and through this evolving situation. My question is, aside from taking the military's word from it, and with the increasing and unexpected amount of numbers of positive cases from the Roosevelt, what kind of detailed assurances can you give to our community that the waste that will be hauled off that ship while it's docked here won't have any type of impact in contaminating us, or just any type of interaction between what's coming off the ship and what's going to the ship for the supplies needed? What kind of detailed assurances can you give the community?
Well, the detailed assurances would be that Admiral Manoni and, of course, his expertise of people are working very closely with us. The CDC people is working very closely with the epidemiologists there. He also had explained to me that they, if necessary, they would bring in their own expertise, their infrastructure of healthcare delivery system, all of that. As far as the waste, I would also have EPA to work with them to make sure that they are following CDC guidelines of waste disposal.
And Nick, your next question, please.
All right, Governor. So the second question was a story we had in the paper today with a woman who tested positive with COVID-19. She shared an experience that she called horrible when the public health investigators came to her home, drove up to her on her street, and yelled her results from the car. Thank you so much for giving me Annette Uggan from the Department of Public Health yesterday to speak to that and the procedures, and that's not part of the procedures. But what kind of advice would you, both Linda and the governor, if I can get your reaction to this, what would be your response to this individual?
Yes, this is not true at all. I did a thorough investigation, and our procedure, we don't just yell and say somebody's positive out at the street. We have very detailed procedures. In this particular case, if it's a COVID positive, once that patient is notified that they're confirmed to be positive, the provider will inform that patient. After the patient is informed, we at the lab also have those test results and we know who is infected. Once we know that, our team will be deployed as far as going into two different types of unit, an isolation unit or a quarantine unit. In this particular case, it will be the isolation unit because the patient is a COVID positive. We do an initial home visit. We go to the home. Our team then assess and says, okay, we need to see and talk to you. Are you the right person? We want to confirm your identity. And once that is done, we also ask the patient, do you know why you are being informed by the Department of Public Health that you have to be really exercising isolation? Do you know what it means? We want to assure you that you understand the importance of remaining isolated, that you don't infect your family remains safe, and that other people in Guam are safe. And then we issue also a voluntary isolation agreement to tell them that this form is there because we want you to remain in voluntary isolation, and whether you're going to be at home or elsewhere, that will be determined based upon things that we also assess while the staff are there with the patient. Before we go into that, we also assess their illness. Do they have any symptoms? How are they feeling? Are your symptoms the same? Or at this particular time, are you worse? Are you getting better? Are you the same? Or we ask, do you have any other symptoms that are severe, like difficulty breathing, or you have tightness in your chest, or your lips are bluish, or you have confusion or inability to arouse? And we let them know if you have any of these symptoms, whether it's later on, then you call 911 or you call our doctor, Dr. Dane Hancock. And if your symptoms are mild and you have no symptoms at all, or that could be the situation. Some people have asymptomatic, no symptoms, and some symptoms are very mild, then home isolation is acceptable. However, we have to also, in our team, when they go out, they assess the suitability of the home environment. They want to find out how many people are in the home. Are there other home that you have members in the household that may have vulnerability to being COVID infected? For example, are there any elderly in the home? Do they have any family members with other comorbidity conditions? And do you have a place, if you're positive, do you have an environment in the home where you can be at your own bedroom, all alone in your room? Do you have a separate bathroom, and so forth? And when we find that the home is suitable and we find out that all the answers to our questions make it determining that the home is suitable, then we will allow that individual to remain in the home. However, if the home is not suitable or the conditions are not met, that they have other household members that have comorbid conditions or they're elderly, then that is not a suitable environment for them to be in. And of course, then we will instruct them that be prepared, that you're going to move to an isolated facility delegated by the government and determined to be for your use, and until you are going to appear that you have a time window that you no longer are going to be infectious. And so we, of course, have the voluntary agreement in place. They also acknowledge that they signed the voluntary agreement, and so they print, they sign everything, and then our staff continues the checking, asking them questions. How are they today? And checking them in terms of their temperature, any types of symptoms they may have. And we do that about twice a day. So that is our protocol as far as that is concerned.
Thank you, Linda. Thanks, Nick, for your question.
But the question was, what was the response to this woman's claim? Is it that you guys investigated and you confirmed that that did not happen? Because
yes,
she said.
Yes, I don't, as far as I'm concerned, that is not true. These are what we implement in our organization as far as the isolation unit and also the quarantine unit in the Department of Public Health and Social Services. And those guidelines are in place.
Thanks, Nick. We'll move on to KOAM. Sorry, I know we had some technical difficulties with you, so we'll go back to KOAM. Nestor, your question? Stand by. Okay. We'll go back to Nestor in a bit. PDN, Steve, your question.
Yes, hi, Governor.
Hi, Steve.
Yeah, hi. Are we currently achieving the goal of flattening the rate of new virus cases to 16.5%?
You know, I just had Dr. Felix Cabrera give another update on his graph, and he is saying that we're moving away from what the spread would have done if we didn't put in these mandates, restrictive actions. And we are moving away from that. He is saying that we are bending it a little, but we're not yet at the 16.5%. We're still at the average of 33%, which is much better than a 200%. But with our actions, with our mandates and so forth, we are starting to move away. So it is showing that it's starting to bend. So in addition to that, I just want to let you know that even internationally, worldwide, if you look at actions that they have done, even in some of the states, the governors are saying that is working, as they are looking at flattening the curve much better. You know, believe me, I track this every day, Steve, because that's of course what we want to see. The last 2 days, I was hoping maybe only 2 or 3, but it's been 6 and 8, I think. And you know, I just have to continue looking at that, because you're right. A lot of it is really dependent on how we also expand more our capacity in the healthcare delivery system. Yeah.
Okay, Steve, your second question.
Yeah, Governor, what's your response to residents who are concerned about your decision to suspend the open government law?
You know, I haven't really gotten any concerns about it. My response to that is that we of course want to be transparent, and we of course want to make sure that public is aware of decisions that we make. I want to make sure, I want to tell you that we are not doing meetings secretively. We're doing it all out in the public with other people, but we're also trying to do virtual teleconference so that we are limiting the ability to make contact with other people. I have not heard anything about people concerned about that. Most of the people are concerned about the test kits. They're concerned about what do they need to do. They're concerned about what symptoms do they need to be looking out for. They're concerned about making sure they don't spread the disease to their loved ones. Those are some of the things that I'm seeing, but I haven't really heard anything about open government.
Well, nor have we had any public boards and commissions that have met.
Right. We have not had boards and commissions. Our immediate meetings that we have, Steve, are among our rapid response team. We meet with our own internal strategy committee. We meet with the medical advisory groups. So the Lieutenant Governor is right. I haven't had any or heard anything of boards and commissions meeting.
Thank you, Steve.
Thank you.
Okay, we'll go back to KUAM. Not
Hello?
sure your question. Yes, we can hear you now.
Okay, great. Thank you. Thank you. Good afternoon, Governor. I just wanted to go back to the testing. From everything I'm hearing on the national media, they say that that's the fastest way to get ahead of the spread of this virus is to do testing, testing, testing. I'm wondering if you can comment on our effort here. And I'll use as an example, the 5,000 or so sailors that are going to be tested according to the Department of Defense. How is it that they're going to be able to test them immediately? And we've only done about less than 300 or so here.
I have no idea, only that the military has their resources within their military population. They have, the federal government they are under the federal government. The Department of Defense is the federal government, so they have easy access to it. I do know that we have been, the president and the vice president has said that because they have now relationships with vendors, they can do now commercial testing. They've relaxed a little bit the guidelines of the machines and the test kits and so forth, that they have more tests now. And I have been talking to FEMA people, Bob Fenton from our FEMA regional director, administrator, and he is working very feverishly to give us the test. He is going to be giving us 500. I asked for like 1,000. He is working hard to give us 500, and I know Linda DeNorsi has been also with the CDC people to get us the 1,000. The states are starting to get them. It's not as fast as they would like it, but as soon as we get the test, we would be able to test more people.
Thank you, and I know that you have been looking at other places to source the test kits from. How is that coming along?
We're working with some vendors from the Asian region. We're just trying to get some approval from FDA to see if we can use those. Dr. Cabrera is also working very hard at getting the Gene expert, so that's another source of testing. Yes, so we are also looking at the Asian region to get the test kits.
Okay. If I can sneak one more question in, Governor, how are you doing? I know a lot of people out here are under stress and anxiety, and I can imagine what you're going through because you're leading all this. How are you feeling?
I'm feeling good. I'm looking at even small progresses as very positive. I think we could have been worse off, Nestor, if we really didn't put all the actions together. I'm healthy. I go out and walk every day. Strength-wise, I'm holding up. When I get home, you know what I do? I just space out. I watch my NCIS and Rachel Maddow and our president on the television, and I say, I just heard him yesterday. But what actually makes me feel good about this whole thing is that I'm seeing a lot of really good, positive response from our community. People that want to help. people that are helping, people that are feeding our nurses, they're feeding our healthcare workers, people that are concerned about first line responders and our healthcare workers. Those are the kinds of things that just make me feel more energized and good. And the bottom line is, you know, as governor of Guam, I really want to protect our people, our health, and our community. I am very concerned, of course, about the economy, but I have to first stabilize our health and then also stabilize our economy. But thank you for asking, Nestor.
Thank you, Nestor. And just some closing remarks from the governor and the lieutenant governor as well.
Okay, well, I just would like to thank again the people of Guam for being very cooperative. I'd like to thank our healthcare and our first line responders who are putting their lives out there in the front line because of their passion to help our people. I also would like to thank the families of the first line responders and the healthcare people, because you know they are now away from their loved ones, and I'm sure they're very worried also about the lives of their family. But all this must be done in order for us to continue living here in our island, our beautiful island. And in order for us to do that, everybody must pitch in. And I just want to say thank you from the bottom of my heart, and thank you for all your help, your ideas, your recommendations, your suggestions, because I do listen to them and I do work very closely to make sure that we do the best for our island. So thank you, and stay tuned for tomorrow. Hope it'll be a good news in terms of positive cases. Thank you.
Lieutenant Governor.
No, just to thank the people of Guam for their patience. I know it's a very stressful time. A lot of people are very anxious out there. But you know, if everybody does their part, stay at home, encourage others to do the same, I think that we'll be able to see this through and minimize the risk that and the impact that this has had on our community. So thank you, everybody, and thank you to the media for continuing to get the information out.
Thank you, Lieutenant Governor. Thank you, everybody. Don't forget the hashtag COVID Heroes GU.
Thank you.